So welcome everyone to Lifestyle Matters, which is my show that I've been doing once a month, where I interview someone interesting and an expert in the natural health or integrative health or functional health space. For those of you who don't know me, I'm a functional health coach and I'm an advocate of all things natural health, committed to helping everyone I meet awaken to the innate wisdom of their bodies and how it can heal itself. Very excited about today's show and today's guest, Dr. Nina Fuller-Shavel. Have I said your name correctly? I always want to make sure I get people's names right.
Yes, you are spot on.
Thank you. Nina has an incredible story and I wanted to let her tell it because I know a little bit about it, but I sort of want to hear from her why we're talking about this today in particular and how this has influenced how she practices integrative medicine. So Nina, I'm just going to hand over to you and get you to share like your origin story with us.
Sure. Well, it actually starts quite a while back, really. So I'm originally a scientist and I started my career really in natural sciences and understanding the human body very much as a systems thing. Okay, it's very much not one thing, one bitty little division, which is very familiar to us from conventional medicine. Scientists view things as quite an integrated whole, and there's a lot of different interrelationships between different body systems. So that's how I always viewed the human body and the human experience. And then I moved in, I did nutrition. So I studied at the Institute for Optimum Nutrition in London. And then I went into medicine because I wanted to really get into the deeper problems of really chronic and very complex diseases. And then I came out and started working in the NHS. And to be honest, I was quite shocked just how little we were doing in any kind of preventative care. And one of the most frustrating things that I found as a doctor working in the NHS was the fact that I would just get my frequent flyers, is what we call them, as people would come in, you get treated for whatever exacerbation or acute problem, and then they just go back out. And you know they're going to be back in a few weeks or a few months because you haven't sorted anything about the underlying problem with their health. And that was very frustrating because you're putting in incredibly long hours. You know, sometimes you could do the good old 12-day shifts on. And you come to the end of that going, okay, so that was a lot of firefighting, but have I made a true long-term difference? And most of the time, the answer was no. And then through all the unsurprisingly shift work and stress and everything else that comes with being a doctor, I then got diagnosed with breast cancer. And then that made me rethink not only my priorities, but also the fact that I was trying to fit myself into a model of care that was never going to work for someone like me who has a broader view of health, who really wants to not just do the acute firefighting, but actually do preventative care and untangle deep, complex problems at the root. And so through my own sort of health journey, I was talking to my oncologist and my surgeon, and they could see that because I was supporting myself with lifestyle medicine and with everything else I was doing, I was having a very different trajectory to some of the other patients. And so one of the times my oncology professor said, you bounce into the room, whereas most people kind of crawl into the room, and you are on some hefty 6 months chemo. And I'm not saying I did that every time. It's just not true. There are ups and downs with all of these treatments, but I certainly could see that my ability to cope with things, because I was doing my nutrition, my movement, my psychological and emotional well-being, yoga, and my sleep, it was a very different experience to what they were used to. And then we did my 6 months of chemotherapy. I then underwent an 8-hour surgery in terms of having my mastectomy and reconstruction at the same time. And again, post-surgical recovery was much better than expected because I was doing the other prehab things. I was prehabilitating myself, preparing myself for surgery and getting my fitness up and running, making sure that I was having good mobility in the upper limbs, all of that stuff. And then I was very diligent with my physio afterwards so that I could actually have full mobility despite quite extensive surgery. And through all of this, again, I could just see the fact that we were doing the right things for people in terms of conventional care. We might be giving the right treatment, but there was no supportive care. Nobody once asked me how I was doing emotionally. No one asked me what I was eating. No one asked me if I was moving. No one asked me if I could sleep, frankly. And so I thought we're missing such a massive part of this puzzle. And that's part of what really galvanized me to make integrative medicine my main goal, really. And after kind of going back to the NHS for a couple of years, I then decided to quit and focus on integrative medicine and precision health full time and set up Synthesis Clinic to help others.
Incredible story. There's so many points in there that I want to dig into. So first one is, the factors that you think that contributed to the fact that, you were pretty young, you're still very young. And, and even though you were a doctor, you developed or, you triggered something in your body that started creating cancer cells, right? And I want to talk a little bit about that. And what do we think are the contributors to that? Is it because a lot of people believe that it's genetic. And I know someone who's on the call actually says that they've got the BRCA gene. And I want to talk a little bit about what are the factors that you think, is it genes or is it environmental? Is it the fact that you weren't sleeping because you said you were doing shift work? So can we talk a little bit about that and what you think it might have been, or what do you know from your research as well as your experience are the contributing factors?
So I think if we talk about in general, I always say that genes are not our only problem. The genes load the gun, but the environment pulls the trigger. Even if you have some very hefty genetics like BRCA, we know not everybody gets cancer, and we know not everybody also gets cancer after their surgeries because they're not entirely 100% proof anyway. So we know the genes are not the only thing. And so even when we look at complex, what's called polygenic inheritance, that means lots of different things stacking up against you rather than having a big predisposition gene like BRCA. So lots of SNPs can contribute to our risks. And I know I have quite loaded genetic SNPs from my perspective. So CYP1B1 and COMT and MNSOD and a few other things. So, but having said that, actually, I believe that it's the environment that washes over those genes that really then triggers any of that predisposition. I also was born in Belarus, so I was pretty close to Chernobyl when that happened. So let's just say radiation exposure would be another contributory factor. And we have indeed found there was a rising rates in young breast cancer in women who were exposed around the Eastern Europe at that time. So we know that's another part of the puzzle. The other part of the puzzle was definitely the lifestyle of being a doctor. I had a 3.5-year-old child at that point, and I was doing shift work. And I remember doing that 12-day stretch. And it was very, very vivid in my mind because my daughter had pneumonia at that time. And so I was up 3-4 times a night, and then I had to go in and do a 12-hour shift and then come back home. And so on the last day of the 12-day shift, I said, if anybody has a cardiac arrest, you better give me the adrenaline first, because otherwise I'm going to be unable to function and do anything for this patient. So I think, unsurprisingly, there's an amount of stress and sleep deprivation that comes from doing this that was also contributing to what was going on. Not to mention, I wasn't particularly diligent at that time while doing work and childcare in measuring things like my vitamin D levels. And I know that my SNPs mean that I need much higher vitamin D levels, so would be in my normal support now. And so, yes, now I'm much, much better at taking care of those things and understanding my own personal matrix of what makes it very, very important to stay healthy.
So I love that you talked about SNPs, because I'm not sure everybody on this call will know what they are. So if people know what SNPs are, drop it in the chat. Say, drop a 1 if you know what a SNP is. Let's just have a look and see. No is good. So no is good because then we've got a starting point. So SNPs stand for, or SNPs stand for single nucleotide polymorphisms. And they're basically just one letter in your DNA that's slightly different between different people. And so sometimes that one letter being different leads to the function of that gene being a bit different. So for example, you've got an enzyme called COMT, which plays a massive role in methylation. And so there are some slow variants of that COMT because of that variant, or fast variants of that COMT. So depending on what you have, you might need, again, different support. You might have different predispositions to different complex and chronic problems. So thank you for explaining that. I am one of those who've got the variation for Compton and crappy detox genes when it comes to estrogen. So it's really important for us to be talking about this because I think women in particular need to be more mindful of their genetic variations. I love that you explained that. I love that you kind of dug into as well the fact that, you know, there were some environmental triggers. You know, the way that you were living wasn't necessarily helpful for creating health, right? Plus the fact that you grew up exposed potentially, you know, or most likely to some radiation. Now, most people can't, you know, they've got children, they've got busy jobs. They can't all decide, well, we're going to quit our kids and quit our jobs. So you said that now you spend a lot more time paying attention to yourself and looking after yourself. What are some of those things that you are doing to take care of yourself now? Because I do find it interesting that, you know, we always say, well, everybody knows what they're meant to do, right? Like we all know that we should sleep properly, we should eat well, we should exercise, but we don't do it because life can become overwhelming, particularly now, you know, for people who have been homeschooling kids, who have been stuck working from home. How are they supposed to juggle those things? Like, what are your suggestions for people balancing their lives and in a more, well, creating balance in their lives?
So I think the first things first is that we can't expect to always be in balance, right? And actually, I think there's a big fallacy in the well-being industry that you're all meant to be zen, floating around, or being balanced. And it's just not true. We will get busy periods. I will get very many busy periods where there's a period of work and where things might not fit in as neatly. But it's about then building circuit breakers within that. So if you know you've got a busy period coming up, you've got to have a circuit breaker at the end, say, okay, let's break that cycle. Let's restore my energy. Let's rebalance and then reboot. And sometimes simple little things. I talk to many busy women in my clinic who either have, you know, complex women's health problems or have been through breast cancer or gynecological cancer or are still going through treatment. And it's about then building in small things and making them habits. Because as much as we can make any healthy behavior as a habit, we've taken the element of willpower out of them. And it's the willpower exercising that's very, very draining to us on a daily basis. We don't wake up and go, I choose to brush my teeth today. We just wake up and do it. So if we can actually establish the same thing for us with breath work, with maybe taking a minute to be mindful while you are maybe having your tea, then we can, chewing well when you sit down, all of those things can then build up and just become a part of what you do. You don't even need to consciously think about them. This is just something that's built in. And, you know, something as simple as breathing is massively helpful. We don't need to sit down and meditate for half an hour, actually, to shift our nervous system state. Just doing 1 or 2 minutes of breath work can profoundly shift our nervous system and give us massive benefits. And for busy mums, sometimes, again, coming in and winding their nervous system down at the end of the day, actually making an effort to do that, even if it is just 5 minutes, legs up the wall pose, breathe for 5 minutes. It doesn't take massive amounts of time to do, but when you get up out of that pose, you will feel different. So small things done well as often as possible is important.
I love that. Little and often. That's the way that you build in good behaviors and good habits. Wonderful. And I love that we talked about breath work. That's one of my favorite things to do. It's why I actually started like studying hypnosis, because I loved the fact that it was building on pranayamic breathing and that you can incorporate the CBT element along with the breath work to reprogram. I suppose that's probably one of the easiest ways of describing it. Reprogram your nervous system and your thoughts and your brain waves. So there was also something that you said that I want to get back to. You said when you were going through all of this stuff, obviously your trajectory looked a lot better than some of the other patients who weren't being given guidance on how to eat, how to sleep. And no one ever asked you, how were you eating? How were you sleeping? And how were you? And this is my personal favorite. No one ever asks when you go to see a doctor, they never say, how often do you go to the bathroom? I don't feel I've ever got, even a gastroenterologist who I've been to has never asked, how often do you go? So I'm curious, like when you work with people, are those some of the things that you ask? Because I know you have got like a team of coaches as well. You have some functional medicine coaches that trained at the same place that I trained at, the Functional Medicine Coaching Academy. So is that is that how you work with people now, that you start to ask these kinds of questions before you go down the route of like, oh, you should be on this supplement or you should be doing these things? What are some of the questions that you ask people in terms of getting them to be more reflective and more mindful of the way that they're acting and behaving?
Well, to be honest, I've been doing this for over a decade now, because ever since I trained in nutrition, I've been asking those questions. So to me, that is not new. And I've been doing it before I was a medic. So in a way, to me, it was weird that medics don't ask those questions, because I've been trained to do it beforehand. But yes, you're right. And I think it's really important to do a very thorough assessment. And so we do have extensive forms that some patients might be a little bit upset about, but it is really important. We say to them, look, the reason I ask you to fill in these comprehensive intake forms is so that I can spend my time in the consultation, not taking down the basics, but really getting into the nitty-gritty and helping you and establishing what we're going to do together and explaining what might be helpful to you. So we do have, intake forms that are quite long, that will ask about family history, what was going on with you, any major complaints, how are you sleeping and what the sleeping problems are, how are you exercising, what are the main sources of stress, any history of trauma, which is immensely important in all of this. And we do go over everything with quite a fine tooth comb. So, and then I spend 90 minutes with my patients in their initial consultation, actually talking to them about everything in great detail.
Fantastic. And this is how medicine needs to be practiced going forward. I personally think, because I've been, I don't want to say a victim, but I have experienced the other side when you are, someone gets you into an office and it's sort of like 10 minutes and they do a lot of scans and some blood work and everything says that it's normal. Actually, that brings me to a point. In terms of things that I've read Naisha Winter's book, and I've actually seen her speak when she talked about the metabolic approach to cancer. So I'm curious, she has this huge, like a matrix of different things that she looks at. So she's not just going to go and run a CA125 or looking at things like, let's see, like she won't just look at the CBC. She's going to look at other things. She will look at some of the things you mentioned, like the genetics. She'll also like zero in on certain things like triglycerides. You mentioned trauma. She will look at that emotional component. I'm curious, how many, just before we move on and Nina answers my question, how many people know who Naisha Winters is? Dr. Naisha Winters. If you know, can you pop it in the chat? Pop a 1 in the chat if you know. Okay. So she's written this great book called The Metabolic Approach to Cancer. And she has, like I said, this matrix of different factors that she looks into that contributes to creating the creation of cancer. So Nina, I have a question for you about that. So do you follow a similar type of matrix, like in terms of your diagnostics and what you look for?
So I've created my own. So I call mine the systems approach to cancer. And I've been developing it over time, really coming from the systems biology of cancer and the science background, because my original training is in science. And then moving on to functional medicine. So again, training with IFM, looking at functional herbal therapy with Kerry Bone and Naisha's work as well. So I've created my own matrix really out of all of those things. And that's what I use. And yes, we will look at all the physiology. So we will look at the whole timeline and looking at predisposing factors, whether it's genetics, family history, transgenerational trauma, which all of that will be part of this. We will talk about precipitating factors. So any triggering things in the lead up to the diagnosis. We will look in depth about in terms of the cancer biology, what type it is, what treatment you might be undergoing, what needs do you have based on that. All of the lifestyle factors will come into it. And then we'll look at the different physiological systems. So we might start with looking at, again, mental, emotional, spiritual health, circadian rhythms, which are very, very important, as we know. We'll look at the microbiomes. I don't just focus on GI because, of course, in gynecological cancers, we need to look at the vaginal microbiome. We also need to look at the oral microbiome for some of the cancers that we might be encountering. Looking at the whole of GI health, which is relevant for, of course, nutrient absorption, gut-immune interactions. We'll then look at the immune system and having balanced immune functions, so reducing chronic inflammation and supporting balanced anti-tumor responses. We would look at detoxification, again, balanced, no crazy detoxes for cancer, but actually properly looking at how do we reduce our toxic load, How do we, if we do know our SNPs or our components, how do we support that? What drugs and pharmacogenetics we might need to look at, particularly in cancer, where there's a lot of medications that we need to be looking at. Is there maybe a different way of managing toxicity from those? And then we look at the circulation tissue architecture that includes the way that cancers grow new blood vessels, angiogenesis, as well as the spread, metastasis, as well as looking at pre and post surgical support, because of course that's important in terms of structural integrity of the body. We'll look at metabolic and mitochondrial health, and then we look at the hormonal side of things. You mentioned those SNPs and the estrogen pathways, and we'll look at everything, all the hormones. So we will look at insulin and yes, estrogen and progesterone balance, and androgens are relevant, and all sorts of things. And then we also will look at methylation and genomic stability as well. So that's how I've kind of split my matrix up, and that's what I use and what I teach to other nutrition professionals and medical professionals in my courses.
Amazing. You're doing such wonderful work. I feel so honored that we have you, and you're giving so freely of your information and yourself. So if you had to, let's say someone was newly diagnosed, all right, let's just say, what sort of advice would you give them? What would be a good starting point, depending on, obviously, not knowing anything about the history, but it's very shocking when someone gets a diagnosis, right? Very, very shocking, very jarring for them, for their families, for work, all those things. What are just some of your pearls of wisdom that you would share with them?
So I think first of all is take your agency back. We know that this kind of diagnosis is incredibly disempowering. And of course, the conventional medical system, even though it's got lots and lots of different tools, is also quite disempowering, because you get told to, here's what we're going to do for you. You go home and rest, or you go home and we'll take care of it. So we've got to take our agency back, and we're going to say, okay, what can I do to support myself? And that's the first question we're really going to ask ourselves. And so being mindful of what our needs are and building on the 4 foundations of good health, which is nutrition, movement, sleep, and psycho-emotional well-being, that will be everything. That's your foundation, which you build any personalized plan. And if you don't have those foundation right, no matter what fancy regimes people go on or what fancy other things people do, they're not going to land right. So having that in place is really, really important. So having a high phytonutrient anti-inflammatory diet is essential. It's really, really important to get that right in straight from the beginning. And there's different resources we use for that. Movement of whatever kind, whatever you can manage. Different people do different things. Even during different treatments, you might do different things. So during the first 3 months of my chemo, I could do walking and I would do yoga. And during the kind of most dangerous time for my yoga, I had some one-to-one yoga, because I couldn't go to a yoga class because I was high risk for infection. And the next 3 months of chemo, I did 5K 3 times a week because I was feeling really well. So it's whatever you can do. It could be bed yoga, it could be chair yoga, it could be a few stretches, or it could be running 5K. It could be anything that you enjoy that gives you the joy of moving your body, gets you reacquainted with your body and shows you it's actually your friend. It's not growing your enemy just because it's got cancer. So it is really important that we use physical practices to actually continue to make our bodies our friends. And yes, sleep and stress, as we talked about, if we don't have those things right, our resilience is compromised.
So many amazing pearls there. You talked about joy. You talked about finding things that you like. I feel like so many people get these, I call them wake-up calls, because I always think that these illnesses or disease, it comes not to attack you, but to actually wake you up into connecting back with your roots, with your essence. And I deal with a lot of women who are burnt out and who are stressed, and they're in that pre-disease state, but they are dysfunctional. Things are not working well, but they haven't been diagnosed necessarily officially with anything major. They may have something like psoriasis, eczema, SIBO, some sort of gut disturbance or a mood disturbance, but nothing as life-changing as, I guess, as a cancer diagnosis, because I feel like that is quite shocking. It's a slap in the face. And for the people who don't know me, I launched my business, I'll never forget it, on the 26th of July. And the night before, my mom called me and I was trying to tell her, I had left Barclays. I had been a well-being manager for 5 years, and I had left Barclays in March, and I was getting really excited about launching my business. And my mom called me on the night before, and I'm busy and I'm printing things and I'm packing goodie bags. And she's like, I really need to talk to you. And I'm like, no, mom, I'm busy. It's 11 p.m. I need to go to sleep. I have my big launch tomorrow. And she's like, no, I saw my doctor today and I have news. And I thought, oh no. And, I got on the phone immediately at 11 o'clock and, cause they were in a different time zone. I was in England, they're in Trinidad. And she told me, she said she had stage 1 endometrial cancer. And it was like the whole world stopped, like everything really just stopped. And, that was in 2017. And it's just been, and I remember the next day, I didn't even care about the launch. I didn't care about if the banners were perfect. Like none of those things mattered anymore. All the things that I was obsessing over, they stopped mattering. And, what really mattered was like, well, and for me, I remember thinking like, this is a person who has sacrificed so much of her life for other people. She's always put other people ahead of herself, her husband, her work, her children, everything went first before her. And unfortunately, I think, she paid that price for it. Like she's only now sort of waking up to the fact that she lived her life for everyone else and not for herself. And she didn't find as much joy as she could have. So now, we're at a point now. I don't know if you knew this, Nina, but I'm actually in Trinidad now because she was in ICU 2 weeks ago. And we're at that sort of stage where it's, she's bedridden. She's probably not going to come back out of bed again. And she's getting a blood transfusion tomorrow. I should hopefully give her another couple of weeks and we will be able to be with her. But we're now asking her those very deep questions. Like I'm probing. I'm like, what have you not done? What do you wish you could have done? Is there anything that we can help you do right now? Because, and I want people to start asking themselves these questions now. Like you don't have to wait till it gets to that point. Like, what have you not done? What do you feel like you're here to do? Do you know what that is? And are you spending enough time doing that? Because very often I get people to do this thing where I say, okay, well, write down what your values are, like what you think is important to you, and then figure out like how are you spending your day. Write down what you're actually doing each day, and then cross-reference it and see like, is this adding up? Like if you say, oh, I really want to spend more time. For me, it used to be, I want to spend more time playing the piano, and I'd look at my day and I'd be like, I'm not playing the piano at all at any point during the day ever. So that was one of the reasons I left my old job, because I'm like, I'm not doing what gives me joy. So people who are on this call, start looking at your life and paying attention to the things that light you up and how much time are you devoting to that, and finding more time, because those things are restorative. They give you energy. They don't suck energy from you. Your children might suck energy from you. Your job might suck energy from you, but there must be some one thing that you can do each day. Something that's a non-negotiable that will give you that joy and that energy, and always put your own oxygen mask on first before looking after other people. Because the only way you can give to other people is if you pay attention to your own needs and acknowledging what those needs are. So I've rambled on and on. I don't know if you have anything to add, but it's just, I'm in that place right now. I'm very raw, very, very emotional, not living on a lot of sleep currently either. So do you have anything you want to add to that?
No, just wanted to say it's also really tough for you to obviously see your mom going through that. And I think that other thing that gets underestimated in cancer is that we all focus on just the person who has the diagnosis. And actually that it's such a systemic disorder. It pervades not only all the different body systems in a way, but also pervades the systems outside of you, whether it's families or friends. And so I think it's important that we support the whole ecosystem. So I quite often talk to patients about who is your support network, how's that affecting you, and also talking about having someone independent to talk to, really, whether it is for a family member or for the person who's going through treatment. Because to be honest, we know we filter, right, Raven? We'll filter all of these things. We can't say the same things to our husbands, to our mothers, to our sister, or to our children that we would if we had someone completely impartial listening. And I think it's really important to have that sounding board, particularly if you're going through a really tough time, because you're not going to want to worry anyone. And particularly, again, women, you talk about women and burnout. It's one of those things whereby, you put everybody else first, you put your knees at the bottom of the bucket. And even when you get cancer, you don't want to worry anyone. And I bet you that probably happened with your mom as well, right? You don't want to worry anyone and you don't want to still put your joy first. And so it's so important to, number one, get someone impartial to listen to help you process, to help just be just co-regulate with you, because that's an important and such a valuable gift anybody could give, and hopefully something that I love to provide to my patients. And then also just, reprioritize your needs. Do it before cancer, but also do it in early cancer, do it at any stage, frankly, because it's so important that you get anything out of it. I say that to people sometimes, can be just a reframing. Sometimes my patients come to me and say, I know I've got metastatic cancer, but being here with you and talking through the things that I can do to support myself makes me feel completely different. You haven't told me anything new about my prognosis. You haven't completely said, oh no, it's all going to be fine. But just because I can be active in my own health and well-being, and I can do something to support myself, and I can do something to shift my mood, and I have a toolkit for coping, that transforms my internal dialogue, that transforms my whole experience. And I think this is something we should be able to give everyone.
I could not agree more. I feel like you have just said like all the magic words, and I think that's a wonderful way to wrap up. So, and before we go, I just want to know, how can people find you? Do you have a book coming? Because I think you should, if you haven't already.
I'd love to find the time for it, but yes, it hopefully will be coming out in the next couple of years. So I will be taking kind of the systems approach out, and possibly, and obviously part of it will be my personal story.
Yeah.
And yes, if people want to find me, I do one-to-one work at Synthesis Clinic, and I have a whole team there for integrative health. So find us there. I have my own website, but that's mainly for professionals looking for training courses, which is drninafuller-shavel.com. So find me on either of those.
Amazing. Thank you so much. That was really, really wonderful. Such a breath of fresh air. I loved everything that you said. There's so much in it that I wish I had more time. And I'd love it if at some point in the future that we come back to this again. And by then, hopefully you'll have the book. Actually, just on that top tip on the book, I'm in the middle of writing a book chapter for a multi-author book. And they've told us that if we want to write a full book, we should use all our previous podcasts and then transcribe them and then start editing them. So you might have already done quite a lot of the work, and you can just get someone
that would be quite handy.
Yes. They said, look, if you're worried about sitting down there and just seeing a blank screen, they're like, if you have previous podcasts, just get Otter, transcribe the whole thing, and then get someone to edit it and turn it into a book. So I was like, actually, that's amazing. So just, it probably might not take you that long.
Very good tip.
Good tip, top tip, right? So thank you for everybody who joined. I know Carlo had to leave, but he shared some amazing thoughts in the chat. If anyone else has any final words or questions that they might want to ask Nina before we let her go, now is your moment. Everybody's walked out, but it was fascinating. I loved all of it. So the replay, I'm going to tidy it up, get it all cleaned up, and we'll send it out next week for everyone. By next Monday, you should have it. And Nina, I'll send it to you as well, so you can make sure you're happy with it. Thank you so much. You're so generous with your time, and just God bless you for the work that you're doing, because the world, not just England, the world needs it. The world really does.
Thank you, my lovely. And so lots and lots of love to you and the family, and anything I can do, just give me a shout.
Thank you. Really grateful. Everybody else, take good care, and we'll see you very soon. Bye-bye.
Thank you. Bye, everyone. Bye.